the gentleman from Tennessee, Mr. DesJarlais.
Thank you, Mr. Chairman. I thank the panel for being here today. Mr. Chandler, if you don't mind, I'll start with you. As you know, in November 2013, President Obama offered a one-year extension to allow individuals whose coverage is being canceled by Obamacare to keep their coverage. What kind of effect did this have on the average health of exchange plans risk pools?
It deteriorated the health of those pools because it provided an alternative for healthier individuals or people with less broad needs to seek out alternatives that Congress had banned.
Okay. Did the administration make both the reinsurance program and the risk corridor programs more generous to insurers in the fall?
Not by statute.
Okay. But?
In effect, by increasing the per-member claims within the exchange plans, they increased the likely bill for the transitional reinsurance program, and they increased the likely amount that will be paid out through the risk corridors program.
Good. Have you estimated how much of a windfall insurers will receive from the administration's changes to these programs?
I have made a series of estimates as to the likely increase in the cost of the risk corridors program. I have not done so with respect to the transitional reinsurance program.
Okay. You discuss in your written statement that risk adjustment contains incentives for insurer fraud and manipulation that need to be monitored carefully. What did you mean by this?
All right. We haven't spoken much about risk adjustment. What risk adjustment does is it requires the insurer to attach some code or set of codes to people. And there's a score for each code. So if you've got cancer, that's a 10. If you've got the sniffles, that's a 1. And the insurance industry then gets paid based not on how much they actually paid, but on that score. There are occasions in which those scores can be fudged. There are occasions in which an insurer might have an incentive to try to get away with a little more than fudging. And so in my view, because of the amount of money involved and because not all insurers are saintly, that needs to be monitored quite carefully by Congress.
How does this relate to privacy concerns for the individual?
Well, in order to see whether insurers are accurately coding people's conditions, including things like, prior miscarriages or cancer or HIV, someone's actually got to go look at the medical records. And yes, there are de-identification procedures that can be used, but it may be that in some instances those will be advertently or inadvertently breached, and so there are at least concerns about privacy that are implicated by risk adjustment.
Now, would this privacy concern only be for those on the exchange or for people who don't go on the exchange as well?
No, people who are in small groups who are not on the exchanges are also covered by risk adjustment, and therefore, even if you didn't volunteer to participate in the Obamacare exchanges, there are issues with respect to privacy there too.
Okay, thank you. Mr. Graham, with regards to the risk corridor program, what happens if insurers systematically set their prices too low?
Well, the risk to the taxpayer increases proportionally.
So the taxpayer's on the hook.
Absolutely.
And I guess going back, this law wouldn't exist today if the Supreme Court hadn't ruled that Obamacare is indeed a tax. So when this bill was originally passed, the taxpayer, the average person out there, didn't know that they were going to be on the hook for this, did they?
Probably not.
Okay. And, furthermore, I guess if the system doesn't work as well as it was supposed to, which we're seeing, in fact, I think the only thing we've been wrong about to this point about the new health care law is that it's even worse than we could have imagined in terms of cost, access, and quality of care. So, the people basically were sold a bill of goods when this health care law was passed. And what are the risks of this deteriorating into a single-payer system if we can't afford the bailouts of the insurance companies like we're discussing today?
Well, I think the risk is present, and I think it's very present because one of the objectives that's been discussed here is that this means insurers will not shun the sick But we're not seeing that. We're still seeing plan design that is causing cancer patients, for example, to have huge out-of-pocket costs. We're not seeing a market arise like Medicare special needs plans. So the neediest patients are going to be let down by Obamacare, and that will perhaps increase the political pressure that you're alluding to.
In my practice of medicine for 20 years before coming to Washington, when we first saw this law, a lot of people were concerned, including myself, that this whole law was simply a funnel into socialized medicine. And this hearing today, it kind of points it more in that direction. And my time has expired. I yield back.